going to talk about Restylane Defyne and Refyne, but also we're going to use Restylane Lift as well, which is for the cheeks. It's a very high G prime. It's a lifting product. But this is mainly going to concentrate on Restylane Refyne and Defyne, in which I'm the largest user in the country, and I'm a very big trainer of Restylane Refyne and Defyne, and I use it a lot, and I love the product. So it's a brand new product from Galderma, and I'll show you why it's unique in a second. So what time do you have? Is it 6 o'clock yet?
6 o'clock right now, yes. 6 o'clock.
Okay.
All right.
All right, so now we're going to start. So I'm Dr. Weiner. I'm in Santa Rosa Beach, Florida, which is the panhandle of Florida. We're between Destin and Panama City. And first off, this is not sponsored by Galderma, and I am not getting paid by Galderma for this, so I'm going to do a lot of things that they wouldn't want me to do, but that's okay because they're not sponsoring this. So, because I'm going to do stuff off-label, which means I'm going to do it where it's not FDA approved. But that's fine because Galderma, although I love Galderma, they're not sponsoring today's event. So we're going to talk about the aging face. So the aging face is caused by both fat loss, muscle loss, and bone loss. It's primarily fat loss. And what you can see in this area is that here's a nice full face at age 35 with a lot of fat pads. And then the fat pads get smaller and they start to descend. And then at age 55, they're much smaller, they're very descended. And these are the fat pads that we need to replace with fillers. I'm also going to be using cannulas. And cannulas are much safer than using needles because there's less bleeding and there's less bruising and there's less discomfort when you use cannulas. I've been using cannulas for over 5 years. I feel it's much safer, there's less risk, there's much less downtime associated with cannulas. A needle pierces the vessels and a cannula bounces off the vessel. I'm going to show you the cannulas in a second. So this just goes over the apex of the cheek, and there's many ways to describe where the apex of the cheek should be. So if you draw a line from the corner of the eye to the lip, and then from the tragus to the nose, there's an area right here that is the apex of the cheek. I like to do it a little differently. I like to go perpendicular from the corner of the eye, the lateral canthus, and then draw a line from the tragus to the ala, and it intersects at about 1/3 between this distance and the jaw, and that's the apex of the cheek too. So in men, it's going to be a little bit more lateral and inferior. So you don't want to feminize a man. So you want to put the apex of the cheek a little lower and a little more lateral. So we also are going to talk a little bit about chins. Okay, and there's a line that's drawn from the chin to the nose. It's called the E line or E plane. And if you draw that line, the lower lip should be about 2 millimeters from that line, and the upper lip should be about 4 millimeters from that line. So in some cases, you need to enlarge the lips. Other cases, you need to enhance the nose or the chin. Mostly the chin needs to be enhanced to get that line in place. Okay, the ages that affect the jaw are very important. I'm going to show you my trademarked reJAWvenation, where we rejuvenate the jaw. And so in childhood, the jaw is very full and has a nice angle to it right here. And in adulthood, it loses a little bit of its fullness, but it continues to have a nice angle. But as you get older, the fullness of the jaw is lost, and the angle of the jaw is lost too. I'll show you another picture of that. So this is radiographs. This is taking x-rays of a young jaw and an older female jaw. And what you see this is a nice angle of the jaw, and what you see is it almost becomes curved. You lose that sharp angle. And as you know, the Victoria's Secret models and all the famous models now have a very firm jawline, and that's the sign of beauty, and that's what we need to recreate in this patient. The other thing that you'll notice is that the upper jaw is also lost. See right here, the upper jaw is more forward. The upper jaw gets retracted. You lose that upper jaw. So we need to approach that as well, and we'll do that too. Okay, so this is really cool. This is specifically a trial that was recently completed by Dr. Noel Solish in Canada. And what it did is it injected Restylane Refyne Defyne in the marionette's nasolabial folds and around the mouth. And this is day one, and this is the after photo over here. And what you'll notice is that this measures muscle strain. It's a very complicated machine that measured this muscle strain. He said it was as big as a treatment room. And what it shows is that in the areas that there's red, there's a lot of muscle strain. And that occurs as you get older, you get a lot of strain around your mouth. But as you injected it, the muscle strain became less. And I'll show you a video of that right here. So look at the muscle strain. A lot of red associated with this and not as much red over here. And that red is the heightened amount of muscle strain. What he actually showed was a 58-year-old patient turned into the muscle strain of a 35 to 38-year-old patient. So that's the beauty of Restylane Refyne Defyne. It relaxes the muscles around the mouth by giving support to them. I'm going to show you what's also special about them. What's also special is something called expression technology, which is the ability for this filler to stretch and contract. All the other fillers are kind of like clumps, which are good to replace lost fat. But when you want to just improve the wrinkles around the mouth and nose area, this product is my go-to choice. This is all I use around the mouth and marionette area now. So this is a picture of actually my wife Sandy. I think it's one on each side. And what is great for is improving the radial cheek lines. These lines that are vertical, they are very difficult to treat. And when she's not smiling, you can't see it. So it's a great product because it blends in with the tissues very well. Okay, and this is a picture of my reJAWvenation, rejuvenating the jaw. And our patient is similar to this patient up here. And you see it just lost the end of that jaw. And what we did is we replaced it right down here. And now she has a very natural jawline, a stronger jawline. And this is, if we're going to go through this, but this is if you have any questions, email us or put them up on the live screen and we'll answer them as we inject. All right, so let's start the injection process. No, actually I want to do one last thing, but let's come on over here. And I want to show you the differences in all these products because everyone thinks, oh, a filler is a filler is a filler, but it really isn't. And so I'm going to start with, this is Restylane Refyne. And I'm going to show you how it kind of stretches as I pull it out. Okay, look at it stretch. Okay, that's unique to this substance. So that's Restylane Refyne. I'm going to change it over. So Restylane Defyne also stretches, but it's a little firmer product. And so it doesn't stretch quite as much.
We have a question from Knees of the Bees. How long do these injections last?
So most of these injections will last you about 12 months, regardless of the product. If you put them in some of the areas, for instance, the tear troughs or temple area, you'll probably get a little longer duration out of it. If you put these products in the lips, you're probably going to get 4 to 6 months, a little bit less. The more movement in the area, the less longevity you'll get. Okay, so that's Defyne. Now I'm going to go to Silk. Silk is kind of my favorite feel, and it just looks and feels like silk. It's a perfect name for it. So Silk is part of the Restylane family. It's made of particles, and it's the smallest particle size filler of the Restylane family. And then you have Restylane. So Restylane's a little bit thicker product. What they do, so there's going to be 500,000 products per ml of the Silk, 100,000 particles per ml of the Restylane, and 10,000 particles per ml of the Lyft. The Lyft, you can see it doesn't stretch. This is a bulky filler. This is used to lift things like the cheeks. the heavy part. So those are the differences in all the products. They're very unique products. So we're going to go over here. She has a little bit of topical. I'm going to.
Miss Theo Skin Health asked if there is swelling afterwards.
So there will be a little bit of swelling, but if you sleep upright and you use cannulas, the swelling's a lot less. So what I'm going to do first is I'm going to inject the cheeks, and then I'm going to do the tear troughs. I always start from top down, and we're going to, no, this is the wrong product. This is it right here. Okay. We're going to use these Easy Guide cannulas, which are really cool. Most of the time in the past, the whole problem with cannulas was trying to find the hole that you started. Well, this new Easy Guide system is terrific because you'll see how easy it is to get the product. So you insert the Easy Guide system, and then you follow it with the cannulas, and voila, you're in. Okay? And then I give that back to you. And so now I'm going to inject into the cheek area this is with Restylane Lift. And I'm deep along the periosteum in the deep fat pads. And I'm just fanning it here. She shouldn't feel this hardly. Do you feel much?
No.
Yeah. And then I come over here and I'm going to enhance the cheek area. And it's a two-handed process. And I want you to focus in on this. And all I'm doing is laying small beads of product in the lateral cheek. And this will enhance that lateral cheek. And we're almost done with the syringe over here.
Josh Ginny asked if you want to keep the shape after having the lips done, should you have them redone sooner than 6 months? Would you recommend alternating products?
I think that you can hold off at least 9 months with the product in the cheek area. So there you see there's really no bruising, no discomfort, and no pain associated with that injection. I'm going to go to the other side. I'm going to leave that sit for a second. Turn towards me. Okay, and we're going to inject over here now. I'm going to first do, oh, can I get another syringe? Yeah. Okay. Okay, here you go. So I'm going to do the lateral cheek here.
Do all these products have lidocaine mixed in?
Yes, they do. Yep. So I'm just injecting the lateral cheek here. And then I'm going to come around and inject the medial cheek. I'm doing it this way to show you how it's done. You doing okay, hon?
I'm doing fine, thank you, sir.
Perfect. Okay, so we've done a syringe of lift in each side. Now we're going to do a little bit of refine, and I'm going to put that close to the eye up here, to the tear troughs. And I come back in through the same port, and now I use 2 hands. I'm feeling where the cannula is over here. Let me turn you a little bit. I'm going to inject the tear trough up here. And the end of it's right in here. And I love to use Refyne in this area because it doesn't have much swelling associated with it, which is awesome. And I'm going to put about 1/2 cc up here. And I go all the way up into the tear trough and I help the area right here. And I keep moving the cannula. It's important for safety factors that you don't keep it in one place. And so that's half a cc of Restylane Refyne in the tear trough. Let me go to the other side.
Some of our viewers are saying they're having connection problems.
Okay, well, we'll try to fix them. I know. So I'm right up here, use two-handed approach, and I'm fixing the tear troughs up here. And I always consider treating the tear trough and cheek as one. You can't treat just one or the other. You need to treat both. And we're almost done up here. I use a two-handed approach, okay? So my tip of the cannula is right there. You can feel very safe using cannulas in this area. Okay, so we've done the cheek, we've done the lateral cheek, we've done the tear trough. So now we're going to go on and we're going to start to do the jaw. Are we all online again? Yeah? Okay, we're online. All right, so we're going to use Restylane Lift now. Let me give you that. And we're going to, let me draw something here. Hold that for me. So let me see you sit up for me, Carolyn. So let's take a look at her jaw. And so all this back here has been lost. Okay, so see this area, see this area? That's what we need to fill. We also need to fill this area. This is called a pre-gel sulcus. And if you look on the side here, okay, her chin does not project quite as much as we'd like, so we're going to put a little bit in the chin. By enhancing the chin, you give the face a more heart shape or a more V-shaped, and that's a beauty as well. So we're going to go here. We're actually going to just fill some of the neck up and try to recreate a jaw right here. All right. So I'm going to turn you a little bit, and we're going to use the Easy Guide system again. Okay, and we're coming in from over here. Here you go. Okay, and now I'm just filling this area up. So I'm along the jawline, and then I fan it down, and I fan it even further down to help with this jaw. reJAWvenation. And it's going to take it takes a lot of filler to do this, but we're recreating her jaw. And then I'll show you what I do as well. We go from a different angle. So we're almost done with 1 cc here. Okay, so then we use a little massage, and I'll show you, and then I'm going to go upwards in this direction, and you'll see how it turns out, okay? And we might actually put in a softer product to smooth that out. But anyways, let's do that. Let's come up here and create the jaw, and we'll come back to that. Lift, lift. Here we go. Okay. So here, now I'm creating a jaw up this way. Here you go. Let me turn you a little bit. So now we're creating the angle. We're going to create an angle of the jaw. How you doing, Carolyn?
I'm doing well, thanks.
Good. And now we'll come back and create a little more. So this is a process. It's not for beginners. And I'll show you the other side too, so we can create a jaw. And there'll be a little bit of swelling that we need to take care of. But you see, we're gradually filling in this jaw. This whole area here used to not be jaw, and now we're filling it. I'm going to put in a little bit of softer product on top, and you'll see it how it layers nicely. And then let's keep going. Is there any questions from the gallery?
No, none here.
Okay. You still doing okay?
Mm-hmm.
Okay.
Can't feel this at all.
Yeah, that's great. Okay, so then we'll come back. I'll show you how I come back and smooth all that out. We'll go to the other side. We have another lift. Okay, so we're down here. We're at the lowest part of the jaw, okay? And we need to fill this in right here. There you go. Okay, I'm using 25 gauge cannulas. This will be a little bit easier to see but you need to fill a lot of product in here. And we're getting there. This might be a little bit easier to see here. Okay.
Darla Smith asks, would you recommend this to reshape the nose?
I use Restylane to reshape the nose, but you could use any of the products, but Restylane is probably ideal for that. Doing the nose has a lot of potential consequences, so that's not for the beginning injector. One more of lift. But you could see getting back in that hole. Sorry. It's not always easy. And that's why the Easy Guide is so good. Let's go with the Easy Guide one more time. There you go. Still good?
Yes.
Good. And now we're going to fill it in more superiorly here. Along the angle of the jaw. There you go. And so we're recreating a jaw back here. And you can see we've recreated that jaw a little more defined up here. And then we're going to go back in. We're going to go back in with a little refine, okay? Here you go. Is this refine?
No. That's left, Dr. Weiner.
Oh, okay.
There you go.
We're going to go in with a little refine here and clean it up. And it's nice to layer the products there. We're almost done here. You still okay, Carolyn?
Yes.
Good. Okay. And I'll show you how it looks when we're done. So Refyne is a great product because it has very high tissue integration as well. So we're going, here you go. Let me have a glass. All right, so I'm going to just move on, but you see we've created a jaw right here. And we'll come back to the other one in a second, but I'd like to do some product into the nasolabial and pre-gel sulcus using Defyne on a needle. So I like to use Restylane Defyne in the nasolabial and pre-gel sulcus. So I use a serial depot technique, and it seems to go quite a long way when you use it this way. You okay, Carolyn?
Mm-hmm.
Good. And so I just do serial depots with the product. And then what I like to do in this marionette area is continue on. There's a little discomfort, I'm sorry. And fill this area with Defyne. Sorry. And let me have one more, please. Defyne. And then what I like to do is in the pre-gel sulcus, I like to inject down to the bone right here with depot injections down to the bone. And that corrects the pre-gel sulcus. And then we'll go to the other side. So let's inject over here, the nasolabial. And then the marionette area. You have another Defyne coming. So these serial depot injections are great because they get it into the dermis. The dermis is where you want to be with this product. And I'll be doing the pre-gels in 1 second here, and then I'm going to use Refyne above. So I'm going to put the pre-gel sulcus going down to the bone with Defyne. And a really good way to look at this, to see if you've corrected properly, is looking from the top down in what we call a water's view. So what you do is you look from up here, and you look at the pre-gels from up here. And That needs a little bit more right there. And you see we've greatly improved the areas around the mouth with this Restylane Refyne and Defyne. And I'm going to show you how I do above the upper lip. I'm going to use Refyne on a cannula now. I'm going to do the ergotrid, which we call, or the upper lip lines with Restylane Refyne. Okay, so I come over here and I use Restylane Refyne above the lip. Sorry about that. But I'm creating thickness in this ergotrid area, and this helps improve those lip lines. I'm not enhancing her lips, although her lips will look a little bit enhanced. And then I can improve the nasolabial the same way right in here. And remember I talked about the upper jaw, the maxilla? Well, you need to improve the maxilla as well using this product. And so I'm improving around the nasal ala and in the nose area. So this is all done with cannulas, pretty bluntly, without any significant bruising. There you go, markedly improved upper lip. Do we have one more of those?
Refyne?
Yes. Here you go. So we'll come on over here. Caroline, still doing good? Good. But see, what you can do is you can do a lot of product here if you use cannulas without major bruising or swelling. Here we go. So I'm just putting it in between the two layers, the mucosa and the skin, and I'm putting a fine layer of Refyne in this area. It looks like Facebook is having problems, right?
Yeah, there's no internet you unplugged it. Do you? Internet.
Okay. The problem with Restylane Refyne, it's a very thick product and sometimes the cannula comes off, but that's okay. We were done with that side. And so we're basically complete on this patient. We've done the pre-jowls, we've done the marionettes, we've done the nasolabial, we've done the upper lip, we've done the jawline. We're going to put a little bit more in the jawline with Refyne. Okay. Why don't we use the 23 gauge cannulas? Here you go. 23 gauge. And we're almost done here. Do you see how much better she looks? Her jawline is smoother and her pre-jowl sulcus. We need to put a little bit in the jaw itself. The chin, okay. So I'm going to use this port and I'm going to turn it around and I'm going to put it into the chin. because she needs a little chin projection. So we're going to put that into the chin. And I'll do the same on the other side. Still doing okay?
Yes.
Good. And now I'm going to put some in this chin. And we put it right there. And it gives her a little more chin projection.
We have a viewer that wants to know what the instrument your assistant is using on the opposite side.
So that is a vibration device, and that improves the discomfort. The brain, using the gate theory, the brain is unable to completely comprehend multiple stimuli at once. So by using the vibration, the brain feels the vibration but doesn't feel any discomfort.
What are the advantages of serial puncture over fanning?
So I feel that you get more productive use of your product. It goes further, and you also get it into the dermis as opposed to the subdermis. If it's in the dermis, it goes much further, so you use less product. And the way this product behaves, it integrates extremely well. You can't do it with other products. You can use Defyne or Refyne in the subdermis, in the dermis, as well as Restylane Silk. So that's the beauty of those products. See, we've made this area significantly better. And look at this jawline over here. So she has a much firmer jawline all the way across. This jawline is firmer. Okay, so and then the nasolabials, and then I'm going to show you a reJAWvenation on my wife, Sandy, right after this. And you'll see it as well. Okay, Carolyn, I think we're done.
What gauge cannula do you use?
Okay, so for Refyne and Defyne, you need to use a 23 or a 25. For Lyft, you need to use a 25. For Restylane,
you're kidding.
you use a 27. Okay?
So do you want to have everyone know how old she is?
How old are you?
72.
72 years old. Can you believe how good she looks at 72? It's remarkable the change we just done in about 30 minutes.
Well, I can't wait to see it.
Okay. So I've come full circle with this. So I used to, and I still do, use Sculptra deeply into the temporal fossa and the periosteum. However, it uses a lot of product. And so after I've done that, I come more superficially and use cannulas, a very dilute solution of Refyne. What I do is I use 1/3 saline, 1/3 product, and 1/3 lidocaine. And so that ends up being a very smooth correction with Restylane Refyne. And you could usually use a half or 1 of cc to do both, to do each temple. So Sandy doesn't need much, but she wanted to correct her jaw a little bit, so I'm going to use the reJAWvenation of the jaw right here. So we're going to use Defyne here. I want you to clean this off for me. Okay, and so we're going to improve the jawline here. We're going to use 23 gauge cannulas with Restylane Defyne. And they don't make the easy guide with the 23s, but because the the port is much bigger, so it's easier to find. And so I'm going all the way back to the jawline here, to the angle. I'm just putting in a small retrograde injection. So what is this good for? This is good for defining the jawline, but it also helps with people who have marionettes because you're putting product behind and it's helping to pull things back. So you also got to go into the pre-auricular area, okay? And I'm almost done with this side. I'm only going to put in a half. But
Dr. Weiner, we have a question about under eye injection. What can I do if the product won't last more than 3 weeks on my under eye circles?
well, there are other products. So you can use Belafil. It's not my go-to choice, but Belafil is a long-lasting product that will probably last you years. You can use Sculptra as well. But these two types of injections need to be done with a very experienced injector. Turn towards me. My experience is this product, any of these products that we're using today, lasts 9 to 12 months. Okay, so here we go. Little poke. I'm going to give it back. And we're going to go. So what we do is we scoot along the jaw. So I'm scooting along the jaw right here. And I'm recreating that jaw line and bring it up to the pre-auricular area. So that's up here. And you just recreate that jawline, make it nice and firm. Square off that angle a little bit more. We're almost done over here. You doing okay, Sandy?
Mm-hmm.
Okay. Okay, so here's a nice firmer jawline with Restylane Defyne. You're good.
Thank you.
No downtime associated with this whatsoever. All right, so that concludes our injection portion. Now